All right, knock, knock, knock. I will wash my hands. Hi, my name is Jay. I'm going to be a nurse practitioner. How are you doing today?
Good, how are you?
I'm good, thank you for asking. Can you verify your name and date of birth for me?
My name is Upal Patel, date of birth March 17, 1994.
Perfect, and you're here for your physical today?
Yes.
Perfect. All right, so I'm going to get started. Can you tell me where you are and what today's date is?
I'm at the clinic. Today's date is April 13, 2025.
Okay, perfect. So at this point, I would address any vitals or history that was pertinent or may needed to be addressed urgently. All right, so I'm going to get my survey. So upon inspection, the patient is alert and oriented ×4. They are sitting upright and they show no signs of acute distress. They appear well nourished and height and weight are proportional for age and gender. They are dressed appropriately for setting and weather. Grooming and hygiene are adequate. Facial expressions are calm and relaxed and speech is clear and coherent. The patient appears to be in good general health, and so I'm going to move on to your skin now, okay? Would you be okay if I touch you?
Yes.
Awesome. So upon inspection, I see no signs of any wounds, lesions, rashes, edema, erythema. The skin color is appropriate for ethnicity. There are no signs of pallor, jaundice, or cyanosis. Now I'm going to touch you with the front of my hands, the back of my hands, same thing on your legs. All right, so skin texture is smooth and skin is intact on both extremities bilaterally with no rashes, lesions, or open wounds. If there were any, I would assess them with my ABCDEs. Skin temperature was also warm and equal bilaterally with no localized areas of increased warmth or coolness. Can I see the back of your hand? Thank you. Turgor is brisk, which indicates good hydration. Now I'm going to assess your head and face, okay? So if you feel any discomfort, you let me know, okay?
Okay.
So now I'm inspecting the head. The head is normocephalic, atraumatic. There are, upon inspection, there are no wounds, lesions, rashes, erythema, edema like that, or anything like that. So I'm going to palpate now. All right. So upon palpation, there are no lumps or depression. On the scalp, hair is evenly distributed with normal texture. There are no signs of infestation or scaling. Scalp also shows no lesions or tenderness noted. Okay, so now, can you smile for me real big? Show me your teeth. Okay, now puff out your cheeks. Okay, now raise your eyebrows. Close your eyes really, really tight. Okay, so facial features are symmetrical with no other signs of lesions, wounds, rashes, erythema on the face. And that means cranial nerve 7 is intact. Now I'm going to palpate your sinuses. I'm going to touch your sinuses. If you feel any pain or tenderness, let me know, okay? So this is the frontal. This is the maxillary. Any pain or tenderness?
No.
All right. Now I'm going to assess your jaw, okay? And as I'm assessing, I want you to open and close your mouth continuously, okay? All right. Perfect. So there's smooth movement when they're opening and closing their jaw. There's no clicking, crepitus, or tenderness noted. Now I want you to close your eyes. I'm gonna touch you with an object. You tell me if it's sharp or dull. Okay?
Sharp, 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 sharp.
All right.
Dull, 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 dull.
Perfect. So sensation is equal bilaterally, and that means that cranial nerve 5 is intact. Now I'm gonna move on to your nose. Okay? Cranial nerve 1, that would assess for smell, will not be done in this exam. Let me know if you have any discomfort, okay? So first, I want you to close one side of your nose and blow out the other. All right, and now the other side. Okay, nasal passages are patent bilaterally. Now I'm going to look up your nose. All right, so lean back for me. Okay, the other side. Okay, so the mucosa is pink and moist. Tubernates are not enlarged. They were seen. There is no discharge, there's scant discharge, which is to be expected. There is no septal deviation. Now, I'm going to assess your eyes, okay? Let me know if you feel any discomfort at any time. So, close your eyes for me. All right, open them back up. All right, so upon inspection, eyelids are symmetrical with no rashes, wounds, lesions, ptosis, swelling on the eyelids. Eyelashes are evenly distributed with no signs of infestation. I'm going to pull down the bottom of your eyelids now, okay? All right, look down, look up, look to the right, look to the left. Okay, perfect. So the sclera are white, the conjunctiva is pink and moist with no redness or discharge. Now I want you to follow my finger, okay? So, all right, now look at my shoulder. Now focus on my finger. Okay, so eye movements are smooth and coordinated with no nystagmus noted. Now I'm going to look into your eyes with a light, okay? Alright, so now I'm going to look inside of your eyes, okay? Alright, and now the other side. Okay. Again, eye movements are smooth and coordinated. Pupils are equal, round, and reactive to light and accommodation. Direct and consensual reflexes are intact bilaterally. The pupil size is 3 millimeters bilaterally and constricts appropriately. Red reflex was observed bilaterally in both eyes. Retina appears intact with well-defined retinal vessels, and the optic disc is round and well-defined as well. Macula is visualized with no abnormalities noted bilaterally. This means that cranial nerves 2, 3, 4, and 6 are intact. And now I'm going to assess your mouth, okay? Let me know if you feel any discomfort at any point. All right. Actually, I'm going to assess your ears first. All right, my apologies. All right, so I'm going to look at both ears first. Okay, so upon inspection, both ears are symmetrical and well aligned with the eyes, and they're free of any redness, erythema, lesions, or deformities noted. Now I'm going to look, well, first I'm going to palpate your ears, so I'm going to touch your ears, okay? Any pain or tenderness anywhere?
No.
All right, and I'm going to touch right behind your ear. Any pain or tenderness here?
No.
Okay, perfect. So upon palpation of the ears, no tenderness was noted. Upon palpation of the mastoid process, there is also no pain or swelling or tenderness noted bilaterally. Now I'm going to look at your ears, look inside of your ears, okay? So lean back a little bit that way. So we're going to pull up and back. Okay, and we're doing the same thing for the other side. Lean that way for me, and up and back. Okay, so after looking inside the ears, the ear canals are clear bilaterally with a little bit of earwax. No earwax impaction or foreign bodies or inflammation was noted bilaterally. The tympanic membrane is pearly gray, intact, and cone of light and bony prominences landmarks were also visualized bilaterally. Now I'm going to stand 2 feet behind you. I'm going to whisper a number or a word, and you repeat it back to me, okay? I'm going to do the left side first, so cover your right ear for me.
43.
Okay. Now same thing on the other side.
22.
Okay. So hearing is intact bilaterally, and that means cranial nerve 8 is also intact. If there were any abnormalities, I would conduct the Weber and Rhine test with a tuning fork to look for abnormalities and where they are. Okay, now I'm going to look into your mouth. But before you look into your mouth, stay right there for me. I want you to read the lowest line you can. So first, cover your right eye. I'm going to hold it about 3 feet away from me and read the lowest line you can.
LTFPH.
Amazing. Now the other eye.
LTFPH.
Okay, now with both eyes.
LTFPH.
Okay, visual acuity is 20/20. Now I'm going to start with the mouth. So looking at the face and the mouth, the patient has a beard where the hair is also evenly distributed. There's no signs of infestations, wounds, lesions, rashes, or erythema. Now, looking at the lips, there are no signs of rashes, wounds, lesions, erythema, or anything like that on the lips. They are also moist. The color is appropriate for the ethnicity of the patient. And so now I'm going to look at your mouth. So smile real big for me. Show me your teeth. All right. So teeth are clean with the appropriate amount of teeth for the age, with no signs of missing teeth, and gums are. Open your mouth for me. Say E again. All right. So gums are pink. Now I want you to stick out your tongue for me. Okay. Now move it to the left, to the right. Now up. Now down. Okay. So tongue is midline, pink, and moist with no lesions or coatings. Cranial nerve 12 is intact. Now I want you to open your mouth for me. I'm just going to take a look inside of your mouth. All right, buccal mucosa is pink and moist and free of any lesions or ulcerations. Now, I'm going to use this tongue depressor. I'm going to press down on your tongue, and I want you to say ah, okay? And I'm going to look at the back of your mouth, okay? Okay. So The uvula rises midline when the patient says ah. The cranial nerves are 9 and 10 are intact. Tonsils, we're seeing they're present and pink with no exudate or swelling noted. I would grade them 1+ bilaterally. Pharynx is also pink and moist. Now, I'm going to push down on your shoulders. I want you to shrug and push up against it, okay? All right, now I want you to push your head this way. I'm going to push back, okay? Okay, and now the other side. Perfect. So cranial nerve 11 is also intact. Now I'm going to move on to your neck, okay? So upon inspection, their trachea is midline with no deviation. No signs of JVDs is observed, but I will again assess that when the patient is laying down. Now, I'm going to auscultate the carotid arteries to assess for any bruits. Okay. All right, so no bruits were noted, and it is safe to palpate. Now I will palpate the carotid arteries. All right, now I'm going to palpate. The carotid arteries are 2+ bilaterally. The pulse pressure is equal on both sides. Now I will palpate the thyroid from behind. All right. So first I'm going to swallow for me. Okay. Perfect. Now look down and to the left. All right. Now look down and to the right. And just look down a little. Perfect. So the thyroid is symmetrical, not enlarged, no goiters, and there were no nodules palpated. Now I'm going to assess the lymph nodes, starting with the occipital. Let me know if you have any pain or tenderness when I touch you, okay?
Okay.
Post-auricular, pre-auricular, then tonsillar, then submen. I'm going to come to the front. All right. Submandibular, submental. So posterior cranial, or posterior cervical. All right. Anterior cervical, supraclavicular. All right. So all lymph nodes were non-palpable, non-tender, and there was no swelling noted. Did you feel any pain or tenderness?
No.
The patient also denies any pain or tenderness. Now I'm going to move on to your lungs, your heart, and your chest. Okay. So first I'm going to assess the chest. All right. So the chest rises equally upon inspection. There are no cuts, rashes, wounds, lesions, erythema, edema noted. The chest rise is equal bilaterally, and the patient is also showing no signs of labored breathing. Okay, now I'm going to move on and we'll listen to your lungs, okay? And I just want you to take a deep breath in and out every time I move my stethoscope, okay?
Mm-hmm.
Deep breath in and out. And one more time. Okay. So lung sounds or breath sounds are clear bilaterally. There were no wheezings, crackles, or rhonchi noted bilaterally. Now I'm going to listen to your heart. Starting with the aortic. All right. Pulmonic. Herbs. Tricuspid. And the mitral. I'm also going to auscultate the PMI. Heart sounds were regular with normal S1 and S2 noted in all areas. No murmurs, rubs, or gallops were heard. I'm going to now palpate the PMI. All right. Okay, the PMI is palpable, approximately about 1 centimeter in diameter, and it is located within normal limits. Now, I'm going to move my hand across your chest, and every time I move it, I want you to say 99, okay?
Okay. 99, 99, 99, 99.
Okay. Fremitus is equal bilaterally with no abnormalities noted. Now, I'm going to move on to your back, so if you can just turn around for me. Amazing, thank you. So now I'm going to assess the back, the posterior thorax, and the lungs. So upon inspection, there are no signs of wounds, rashes, lesions, erythema, or edema noted. Now I'm going to listen to your lungs again, okay? Take a deep breath in every time I move my stethoscope, okay?
Okay.
Deep breath in. And out. Again. And out. And out. And out. In, out, in, out, in, and out, and again, in, and out. Okay, so breath sounds are clear bilaterally with no adventitious sounds noted. Now I'm gonna, again, listen, but every time, I'm gonna do the same thing again with my stethoscope, but I want you to say 99 every time I move my stethoscope, okay?
Okay.
All right, go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so the sounds are muffled and indistinct, which is normal and to be expected. Now I'm going to ask you to do the same thing. I'm going to move my hands this time. I want you to say 99, okay?
99, 99, 99, 99.
Perfect. So vibrations are symmetrical bilaterally with normal lung tissue density. That was the same for the posterior thorax and the anterior thorax. Now I'm going to give you gentle taps on your back, okay? And I want you to let me know if you feel any pain or tenderness when I do that, okay?
Okay.
Any pain or tenderness noted?
No.
Okay, so percussion notes are resonant throughout. Well, I'm going to give you a couple more gentle taps, but there was no CVA tenderness noted on either side, which indicates there are no signs of renal inflammation. I'm going to do the taps up here on the rest of your back, okay? Any pain or tenderness when I did that?
No.
All right, so percussion was resonant throughout, which is to be expected. No areas of dullness noted. Now, I'm going to move on to your abdomen. So if you could lay down for me, please. Perfect. So first, I'm going to inspect the abdomen. So upon inspection, there are no visible scars, lesions, stray, pulsations noted anywhere. Are you feeling any pain in your abdomen at all?
No.
Okay. And then the contour is flat and symmetrical. So now I'm going to listen to your stomach, okay? Starting with the right lower quadrant. Vowel sounds are normal active in all quadrants. Now I'm going to give you light taps and let me know if you feel any pain anywhere, okay? All right, any pain or tenderness when I did that?
No pain.
All right. Did you feel that? Are you good?
Yeah.
Okay, so there, I note tympany all over the abdomen, over the majority of the abdomen. There was dullness over the liver, which is to be expected. Now I will palpate lightly for any tenderness or guarding. Let me know if you feel any pain, discomfort, okay?
Okay.
Any pain or discomfort when I did that?
No.
All right, I'm just gonna do that a little bit harder again, okay? All right, so there, upon palpation, there was no tenderness, rigidity, or palpable masses. I did not feel any enlargement of any organs. So now I'm going to palpate your liver, okay? I'm gonna put my hand right here. Now take a deep breath in and hold it. All right, so the liver edge is smooth, soft, and regular. I felt about 1 to 2 centimeters in size, which is normal. If anything larger would be considered abnormal and would need more further testing. Now I'm going to palpate the spleen. I'm going to do the same thing. I'll put my hand on this side, okay? And then take a deep breath in and hold. Okay. The spleen is not enlarged. It was not palpable. Now I'm going to assess the kidneys again. All right. Okay, and we'll do the same thing on the other side, okay? So, the kidneys are not palpable, that means they're not enlarged. I'm going to do the Murphy sign to assess for gallbladder inflammation. All right, so first I'm going to start off right here, and we're going to kind of do the same thing we did for the liver, okay? So I'm going to put my hand here, take a deep breath in, and I'm going to kind of push here. All right, so the patient reports, was that painful or tender at all? Okay. The patient reports no pain, so Murphy sign is negative. That means there's no signs of gallbladder inflammation. Now, if you can sit on back up for me, please. Do you help? Okay. Okay.
Thank you.
So now I'm going to assess vascular status. So first, if I can see your fingers, your thumb. Okay. And I'm going to do the same thing to your toes. Okay, so capillary refill is brisk and less than 2 seconds in all extremities, indicating good peripheral perfusion. Can I see your fingernails? All right, so there's no clubbing of the fingernails. The nail bed angle is within normal limits. Now I'm going to palpate the arteries. So I'm going to start with the carotid. I have already palpated those, but I will palpate again. So just look straight for me. All right, carotid, now brachial, so just kind of, yep. All right, radial on this side. I'm going to do the same thing on that side. Brachial. And then radial. Let me just do that again. Okay, and then the dorsalis pedis and the posterior tibial. So, all right, so I'm gonna. All right, and then the posterior tibial. Okay, so all pulses are present and strong. They're 2+ equal bilaterally. Now I'm going to assess for edema over the ankles and the shins. I'm just going to kind of press here. So there's no pitting edema noted bilaterally. Skin rebounds quickly, and there are no signs of swelling. Now, can you stand up for me, please? Perfect. So I want you to walk that way, 6 steps, and then come back for me, okay? Okay, and back. Okay. The patient walks with a steady gait, steady coordinated gait. Tandem walking is also smooth and balanced. Now I'm going to ask you to close your eyes, hands by your side, and just stand there for 20 seconds. All right, so the Romberg test is negative. The patient maintains balance with eyes closed. Now I'm going to again touch you with an object, and I want you to tell me if it is sharp or dull, okay?
Sharp, 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 sharp.
All right, again.
Dull, 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 dull.
Okay, Perfect. Sensation is intact to light touch in all extremities bilaterally. Next, I'm going to assess deep tendon reflexes. So first, I'm going to assess the biceps. So right here, just relax your arm, just let it hang. Okay. And now I'm going to assess the triceps. Just relax. Okay. And then the brachioradialis. Okay. And do the same thing on this other side. Okay. Relax completely. Okay. All right. And then again here. Okay. And then if you can sit down for me on the edge of the bed. Thank you. I'll look back a little bit. All right. Relax. Okay. Okay. And the other side. All right, so reflexes are 2+ and symmetric bilaterally. All right, now we're going to keep moving on and we're going to look at your back. So if you can stand right back up for me, please. All right, so turn around. Perfect. So when looking at the spine is symmetrical. When the patient is standing, the spine is midline with no deformities noted. The scapulas are symmetrical, no asymmetry of the shoulders noted, no asymmetry of the hips noted as well. There is no lateral curvature noted. When the patient is standing, if you can bend forward that way for me. All right. So when feeling the spine with the patient bent forward, there is no lateral curvature of the spine. The scapulae are still equal and symmetrical, and there's no rib hump as well, so we can rule out scoliosis. Now I'm going to, if you can turn back around for me, I'm going to assess range of motion. So I want you to just follow everything that I do, okay? So first rotate your wrist, now down, up, all right, down again, up. Now just kind of roll your shoulders front, now back, the other way. Okay, now raise your arms out above your head, in front, back down, and do it the other way back around. Okay, now I want you to sit down for me. Okay, so I want you to roll your ankles. Yep, roll your ankles the other way. Okay, now put your feet up like this. Okay, now down. All right, so the patient has full range of motions on the upper and lower extremities. Now I'm going to assess muscle strength. So first, I want you to push out, and I'm gonna push your arms in, okay? And you resist, okay? The same way, the other side. All right, now hands up like this. I'm gonna pull down, you pull up, okay? All right, now you push down, I'm gonna push up, okay? Same thing for your legs. I'm gonna push down inwards and you push back up. All right, for the back. Same thing for your feet. The other way. All right, so strength is 5 out of 5 bilaterally on both upper and lower extremities. And then now I'm going to perform the Phelan's test for carpal tunnel syndrome. So I want you to do this. Yep, all the way, touching. And now hold it there. Let me know if you feel any pain or discomfort. I would have the patient hold it for 60 seconds. Let's assume it's been 60 seconds. Go ahead and release. Do you feel any numbness, pain, tingling in your fingers, your arms, or wrists?
No.
Okay, so Phelan's test is negative, which is to be expected. And that concludes my head to toe assessment. Thank you.